While it's very exciting that we all get to spend more time outdoors, it's important to remember that we may be more susceptible to sunburns and sun damage. So we have to be extra mindful to make sure we're practicing sun safety to reduce the risk of sun damage and potential risk of skin cancers in the future. Some useful sun protection tips to protect ourselves from skin cancer would include the application of sunscreen. We recommend at least SPF 30 and broad spectrum sunscreens that should be reapplied every few hours when outdoors. We recommend using sun protective clothing such as hats and long sleeves. We recommend avoiding direct sun exposure during peak times between 10 a.m. and 2 p.m. during the day. And of course, avoiding all tanning bed exposure is also very important. Basal cell carcinoma is the most common. This usually presents on the skin as a pearly pink papule, and sometimes these can have a central scab in the middle, and they can sometimes bleed with minimal trauma. The next type is a squamous cell cancer. They usually show up as a bump or a nodule on the skin, sometimes with a central scab or crust that just doesn't heal. And then the last type of skin cancer that we see commonly is called a melanoma. And this is the most concerning, and it arises out of the cells that make up moles. And some clues to that would be a pigmented mole that may be asymmetric in its shape, it may be variable in its colors, or if it's a new mole that's been newly noticed or one that's been changing or growing over time. While skin cancer is common, the good news is that the vast majority of them can be successfully treated. In the portion of patients who are diagnosed with an advanced skin cancer, there's been a number of very exciting innovations in the field of medicine and oncology that have greatly improved the outcome when treating these patients, using treatments such as immunotherapies, which help to boost the patient's own immune system to fight the cancer.